My screen showed an increased chance for Down syndrome. What now?
The first thing to remember when you receive a screen with a positive result is that the vast majority of women who receive a positive screen have normal babies. If your risk comes back at 1 in 100, remember that 100 women with the same risk, only one of them will actually have a baby with Down syndrome, the other 99 will not. Understanding how you feel about those numbers will help you make a decision as to whether or not you'd like to have the diagnostic test, which is amniocentesis. And amniocentesis is done about between 15 and 22 weeks. And your results from the amniocentesis will come back in about 2 to 3 weeks.
My screen showed an increased chance for Trisomy 18. What now?
The most important thing to remember when you receive a positive screen for Trisomy 18 is that this condition is quite rare, and the vast majority of women who have a positive screen actually have normal babies. If your risk is 1 in 200 for having a baby with Trisomy 18, only 1 out of 200 women will actually have a baby with this condition. The other 199 will not. So you will be offered an amniocentesis within a week of receiving this result. If you can't decide whether or not to have an amniocentesis, some women have an ultrasound first. Babies with Trisomy 18 often have abnormalities that can easily be seen on ultrasound, and this might help you decide whether or not you'd like that diagnostic test. If you receive a positive screen for Trisomy 18, you will probably be sent to Vancouver, Victoria to see a maternal fetal medicine doctor or a genetic counselor who will talk to you about the details of Trisomy 18 and help you decide whether or not you'd like to have an amniocentesis. If you have an amniocentesis, your results will come back within 2 to 3 weeks. It can be quite stressful waiting for your results, so having a support team around you can be very helpful.
My screen showed an increased chance for an open neural tube defect. What now?
If your screen is positive for an open neural tube defect, you'll be offered a detailed ultrasound. The vast majority of these open neural tube defects can be seen on ultrasound. You'll also be offered an appointment with a maternal fetal medicine doctor or a genetic counselor, and they'll explain what an open neural tube defect might mean for your baby. You may also be offered an amniocentesis depending on the results of the ultrasound.
What is amniocentesis?
An amniocentesis is a test that pregnant women typically have done anytime after 15 weeks of pregnancy. It's typically used to diagnose a condition like Down syndrome or Trisomy 18. A needle is inserted through the mom's abdomen into the amniotic fluid around the baby. A small sample of this fluid is obtained and sent to the lab, and it typically takes 2 to 3 weeks to get the results back. During the entire procedure, we watch what we're doing under ultrasound, and by doing so, there's no risk of the needle hurting or harming the baby. There is, however, a small risk of miscarriage associated with the procedure, so unlike a blood test or an ultrasound, it does carry a small risk associated with it. If we did the procedure on 200 women, 1 would have a miscarriage directly as a result of the test.
What is a detailed ultrasound?
An ultrasound uses harmless sound waves to determine how well your baby is growing and developing. A detailed ultrasound is typically done between 18 and 20 weeks of pregnancy, and what we do is we look at your baby from head to toe to make sure that all the organs are growing and developing the way they should. Examples: how the heart looks and how the brain looks, and so on. It can also be used to diagnose birth defects like an open neural tube defect. We also look for certain clues on the ultrasound that may increase your risk of having a baby with a condition like Down syndrome.
What if my baby has one of these conditions?
Your healthcare provider will let you know whether or not the diagnostic test has confirmed your baby has Down syndrome, Trisomy 18, or an open neural tube defect. If your baby does have one of these conditions, you'll be offered the opportunity to come talk to a genetic counselor about what your options are. Making a decision about your pregnancy can be quite difficult. Some women choose to end the pregnancy, some women just like the information so they can prepare for having a baby with special needs, and some women decide to put their babies up for adoption. Your healthcare provider, your genetic counselor, and your family will help you make a decision about what's right for you in your pregnancy.